Well, let's go over to how indeed we can manage to slow down the rate of infection. Joining us from the United Kingdom is Dr. Essien Ukarabi. He's a GP registrar with the NHS. Thank you for joining us at this time.
Thank you very much, Millicent.
All right. Dr. Ukarabi, tell us about the gains in the healthcare system there in the United Kingdom, especially with battling COVID-19. The Prime Minister is back again at the helm of affairs, and he was briefing today saying that England is past its peak.
Yes, very good to announce today. The Prime Minister said for the first time that the United Kingdom has now passed its peak, and the curve for the coronavirus has started to decline, which is a major gain for the health sector in the United Kingdom. Also, we can see in the last couple of days that the number of hospital infections hospital admissions, I beg your pardon, have reduced significantly. Also, the number of new infections have also reduced in the United Kingdom. And that's a plus for the system. And that goes a long way to show that the two systems that were outlined by the UK government, which is the capacity boosting and the social distancing technique, has actually worked. And yes, we've seen quite a lot of people die in the United Kingdom, more than 26,000 people. But there is some light at the end of the tunnel as we approach the coming days.
Here in Nigeria, after the briefing, the Committee on COVID-19, there's been talk about limited bed spaces, especially in Lagos with its numbers. But then, of course, more work is being done to ramp up testing across. But what's your take on perhaps how we're doing, especially to stopping the stigma? We still hear a number of people who go into hiding as soon as they're told they're positive.
Right. Nigeria has got a very large population, and it's important that Nigerians get tested. It's important that we know those who are positive for coronavirus, just like we have done here in the United Kingdom. So we have ramped up testings to include the vulnerable groups, the healthcare workers and their families, the carers and the residents in the care homes. So a large number of people are being tested, and we have been able to see the trend of the virus from this large scale of testing. That's the same thing that we expect in Nigeria, even though I know there is a global challenge as regarding testing kits and things like that. But Nigerians need to be aware that if people are not tested, then we might see this virus spread, as we are seeing at the moment in Nigeria, very quickly, and we don't have the health facility to contain this virus should it spread massively. So one of the things that the social distancing does, and which it has done for the United Kingdom, is that it has slowed the amount of hospital admissions at every particular time. So social distances reduces the number of people you have admitted into hospital, as well as the number of people you have on ventilators and the number of people you have in the intensive care unit. If we are not testing in Nigeria, we might get to a situation where lots of people have become infected and lots of people need hospital admissions, and it will be a major hit to the health sector. It will be a major hit to the intensive care sector in the Nigerian health system. And I think they might not just be prepared for that and be able to contain that. So I think it's better for the NCDC to ramp up the testing, to ramp up the tracing, and also the treatments of those that have been infected at the moment.
But finally, how do you think we can reach the unbelievers of this virus existence?
Well, there is a lot of proof to show that coronavirus is real. We've seen more and more survivors come on air to speak about their symptoms. I personally have treated patients that have had coronavirus. I have seen patients that have died from coronavirus. In the UK particularly, you would realize that about 80-something healthcare workers have died from coronavirus, and 60% of that number have been from the Black, the Asian, and other minority ethnicity. So it tells us that Nigerians are not exempted from the virus. It tells us that Blacks are not exempted from the virus. As a matter of fact, the Royal College of Surgeons today moved the motion that Black and Asian doctors, as well as other minorities, should be removed from the hotspots where we have these patients with coronavirus, because it looks like Blacks are more susceptible. So Nigerians should be aware, those who still don't believe, those who still think that it is a scam by the government, that people are dying. We have 26,000 people in the United Kingdom that have died from coronavirus. Over 50,000 people in the United States have died from coronavirus, and over 200,000 people globally have died from coronavirus. That statistics alone should help Nigerians to stay at home. Finally, before I end, I also understand that the government is planning to ease the lockdown. In my opinion, I would say that this has come rather, earlier than expected. There are modalities that I believe the government should follow before considering easing the lockdown.
I wish we had more time. We're told to expect a few of those modalities later today. But thank you, Dr. Esther Ukorobi, GP Registrar, NHS England. Thank you for joining us on the program.
Thank you very much.
So to come on our COVID-19 update, what does a post-pandemic economy look like? We have a guest who joins us later on that.